After heart surgery, especially procedures that involve opening the chest such as bypass surgery or valve replacement, your body enters a delicate healing phase where even routine actions like coughing, sneezing, throat clearing, or laughing can unexpectedly strain the chest muscles, breastbone, and surgical stitches. Which is why using a pillow to support your chest during coughing is not a minor comfort tip but a medically recommended protective technique that plays a vital role in safe recovery, because coughing itself is essential after surgery to clear mucus from the lungs, prevent pneumonia, and maintain good oxygen exchange. Yet without proper support it can create sudden pressure across the sternum, causing sharp pain, fear of coughing, poor lung expansion, delayed healing, or in severe cases even loosening of chest wires or reopening of the surgical wound. When a patient gently but firmly holds a pillow against the chest before coughing, it acts as a stabilizer that absorbs force, reduces movement of the healing breastbone, and distributes pressure evenly, allowing the lungs to perform their natural clearing function without transmitting harmful stress to the incision site, which is especially important in the first few weeks when tissues are still fragile and inflammation is present. Many patients instinctively suppress cough due to pain, but doing so can lead to mucus buildup, lung infections, breathlessness, and prolonged hospital recovery, making pillow-supported coughing not just a comfort measure but a preventive strategy against respiratory complications. The correct technique involves sitting upright or slightly reclined, placing a clean pillow firmly over the chest incision, hugging it with both arms, taking a slow deep breath, and then coughing gently but effectively, allowing the pillow to support the chest wall throughout the action. And this should be practiced consistently during the day whenever coughing is needed. Caregivers and family members should encourage this habit, remind patients to keep a pillow nearby at all times, and ensure it is clean and used only for support, because repetition builds confidence and reduces fear, which in turn promotes better breathing, improved lung expansion, and faster return to normal activity. From a cardiac perspective, minimizing pain and stress responses during coughing also helps control heart rate and blood pressure, reducing unnecessary strain on a healing heart that is still adapting after surgery, and this is why cardiologists and cardiac surgeons strongly emphasize chest support during respiratory exercises. Over time, as healing progresses and pain reduces, the need for firm support gradually decreases. But in the early recovery phase, this simple pillow technique becomes a powerful tool that protects stitches, preserves surgical integrity, encourages effective breathing, reduces complications, and allows patients to recover with confidence rather than fear. Proving that sometimes the most effective medical advice is also the simplest. Support your chest, respect your healing body, and allow your heart and lungs to recover safely together.